everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, I would like to share with you ways that you can approach your transition by outlining 3 primary goals within your transition. The reason why I want to share this with you is twofold. One, I see a lot of people jumpstart or get into their transition without really any goal setting in mind. And as a result, it can be very, very difficult, especially if you're not working with a therapist, if you're not working with a gender specialist who will essentially set up these goal settings for you. So if you're doing a lot of things solo, it can be really overwhelming. And when it feels overwhelming, we tend to pull back and we tend to give up. And I don't want you to give up. So I want you to be very clear on what you're trying to achieve. And the way I explained the 3 goals are really going to help you to be able to see them better. It's really going to help you understand a lot of elements of your transition much, much better. So, goals are very, very important. Having a clear idea of where you're going is imperative to transition. Understanding how you look at the goals is also very essential because it will help your mindset. And in transition, because it's such a process, trust me, it is all about mindset. Mindset and perspective, how you look at it, how you deal with it is going to go miles and miles and miles in being challenged, in meeting any tension, in meeting any kind of challenges in front of you or any obstacles. So mindset is important. And knowing what your goals are and knowing how to reach those goals is going to be imperative. So, if you are either already in transition or if you are starting in transition, this is going to be really helpful for you just to contextualize your process for yourself better. This is, by the way, something that I do with a lot of my clients. So you're kind of getting almost like this one-on-one direct coaching here. Transition. If you're planning to transition, it is very imperative for you to define what there is for you right now. That may change, and that's okay. For right now, I think it will be very helpful for you to ask yourself, what would you would like to, if transition is your overall goal, what would you like to get out of it? For some of you, it will be achieving full congruency. For others of you, it is achieving an element of passability. For others of you, it is about becoming more comfortable with who you are. For some others, the rest of you, it might be to minimize dysphoria. For the rest of you, it might be what are the little things I can do without necessarily fully physically transitioning because perhaps you can't for medical reasons or personal reasons or otherwise. Each one of your transition goals are going to be very, very different and they may change with time, and that's okay. For now, I want you to ask yourself, what is your today, right now, if you look at your situation, what is your current goal today? And I want you to be very, very clear on what that goal is. If your goal is to achieve full congruency, what exactly does it mean? What type of surgery will that entail? What type of medical intervention will that entail? If your goal is to achieve a closer sense of confidence and comfort, what is that going to be for you? So outline as clear as you can what that particular right now, your transition overall big goal looks like. Now, this is going to be your main goal. This is something that you put if you have a planner or if you have a notebook. This is going to be the top tier. This is pretty much the goal, right? This is either your annual goal, maybe it's going to be your 2-year goal, maybe it's going to be your 3-year goal. Maybe you're not even going to put a time on it right now and just call it the goal. Imagine it in any other way. Maybe it's the house that you're planning to build metaphorically. Maybe it's the mountain you want to climb metaphorically. Maybe it is the doorway you want to walk through. But this is your the goal. Now that's what we're going to try to go for. What I want you to know, this is the mindset part, is that the goal doesn't get built overnight. And there are steps underneath this big, huge goal that we're going to have to outline to get you, to set you up how to move forward, okay? Underneath this big goal, underneath like this huge, humongous goal, what you're going to do is you're going to set up your stretch goals. Stretch goals are going to be elements of the bigger goal that are fall in the category of something that you do or a procedure or a process you go through, and within a relatively short period of time, you get your results. Stretch goals. You can call them something else. You can call them mini goals. You can rename them, but that's the next tier down. Example of stretch goals would be Getting top surgery is an example of stretch goal. Why? Because you make an appointment, you go for you set up an appointment, you set up surgical date, you go through the surgery, you wake up with the chest of your desire. That's a stretch goal, or that's a mini goal within that big goal. It is something that you get to achieve in a relatively short period of time when it actually does happen. Another example of stretch goals is going to be going to a medical doctor for hormones, sitting down with a doctor, getting understanding of all the pros and cons of being on hormones, getting prescription and studying hormones. That is also a stretch goal. Again, stretch goals are going to be things that you're going to do and they're going to give you immediate results. Maybe it's going to be set up an appointment with a therapist and having a session and feeling better as a result. That's a stretch goal. Another stretch goal might be maybe it is going to be for you to set up an appointment with a stylist to help you how to style your look. Stretch goals. Underneath the stretch goals, you're going to have maintenance goals. What are maintenance goals? Now, maintenance goals are going to be little tiny things that you're going to do that take a while, they take some time, they don't happen overnight. It takes quite some time for the maintenance goals to set into place. Maintenance goals are going to be continuously taking your dosage of hormones. It is going to be hair removal. For those of you who are interested in hair removal, remember when you go for the hair removal, whether it's laser or electrolysis, it doesn't happen overnight. You don't just go for it and you come back and your face is cleared. This is why it's not a stretch goal, it's maintenance goals, because it usually takes time. For some of you, it will take 6 months. Some of you, it's going to be 12 months. For others, it's going to be 18 months to longer. That's a long time. That's a maintenance goals. Maintenance goals is something that you maintain, that you have to invest your time and energy in order to maintain until you actually can close the door on that goal. So that falls in the category of maintenance goals. Maybe your maintenance goals is also going to be constantly affirming yourself in front of your loved ones until they finally start using your preferred name and you pronounce. That's also maintenance goals. Maintenance goals, remember, are the things you do that are going to be something that you have to maintain as part of your transition. Now, maintenance goals are the most difficult ones to wrap your head around because maintenance goals is part of the transition all of you hate. Reason being is because it takes time to see results. Voice therapy is another great example of maintenance goals. It takes time to get your voice modulated to the point where you want to be modulated. Hair growth is a maintenance goal. For those of you who are trying to grow your hair out, it takes some time and it takes patience and you can't fight it. You just gotta let it go. Some of you, it might be, cultivating particular style may be a maintenance goal. And they're very frustrating, right? Because they're not immediate. Also, waiting for HRT to give you results you desire is part of maintenance goals too, because it doesn't happen overnight. So it's very, very frustrating as you wait. And a lot of times it feels, the spirit with maintenance goals feels like nothing is happening and feels like nothing is going to happen, but it will happen. What you have to remind yourself is that this is part of maintenance goals. And you have to remind yourself that maintenance goals are that. They take time. They require patience from you. They require for you to be a little bit more, distressed, a little bit more calmer when it comes to this maintenance goals. Yeah, it's frustrating. It is very difficult, but they're not stretch goals. They're not something that you can go in and get done. They're not like facial feminization surgeries that you can go in, you get the surgery done, you heal, and you feel better, you look better, and you feel more confident. Maintenance goals are something different. This is why the mindset piece comes in very, very important. When you have a planner or when you have an actual outline somewhere of this is my main goal, this is my transition, that this is what I'm trying to achieve within my transition. Okay, now I'm breaking it down even further. Underneath my transition, this is the stretch goals I would like to hit. Maybe this month, maybe this year, maybe next year. What do I need to do now in order to make the stretch goal complete? What do I need to do in order to get breast augmentation? I need to contact the doctor, set up consultation. Things suddenly become very clear and much more tangible for you to carry out, and you become more organized in your transition versus realizing that, holy shit, I'm having a lot of dysphoria in relationship to my breast. I gotta have breast augmentation right now, and then realize that the doctor you want is booked a year in advance. Having it outlined will help you with that. Then you're looking down and now you're like, okay, what are my maintenance goals? What do I have to do this week in order to maintain things in my transition? Gotta make sure I remember my hormone dose. I gotta make sure I remember to make that appointment for electrolysis. I gotta make sure I practice my voice. I gotta make sure that I go ahead and do this. I gotta make sure I go ahead and I do that. That's going to keep you more in control. It's going to keep you more focused. It's going to help you to be much more organized versus disorganized. When we feel disorganized, when we don't know and we're kind of just moving with dysphoria and we're shooting in the void, meaning one day you feel very dysphoric about this, so you gotta go fix it. Then you feel very dysphoric about that, you gotta go fix it. You feel all over the place. And it takes tremendous amount of energy to actually to do that, to run around doing everything. This way, you can be really focused. This way, you can also look back at your goals and you can actually see that, wow, I've been doing this maintenance goal for 6 months. Wow, I'm starting to really see the results. Yes, it takes time, but I'm seeing the results. Wow, the stretch goal just happened. I can now celebrate my wins. So this is one of the greatest way to look at your goals, is to break them down into these 3 categories. Your transition goal, exactly what it is. Be very, very clear with yourself. Your stretch goals, what are the things that can happen and they give you results immediately? How can you set them up and make sure that they happen too? And then look at the maintenance goals. Things that you're going to have to do is that part of the maintenance, and the maintenance goals, remember, they're like popcorn. They, at first, you don't see them, you don't feel them, and then suddenly they start popping out of nowhere because things capitalize, all of that energy capitalizes, and then starts snowballing on its own. So comment below, let me know, do you set goals for yourself for transition? Have you set the goals for yourself? Have you thought about actually setting out your transition in a goal-setting way? Because I think you absolutely should. It is very, very helpful. And if not, share with me below, share with everybody else. What is going to be your, maybe share just one stretch goal. What's your stretch goal for this year? What's your stretch goal for this month? What's your maintenance goal that you're struggling with right now? Share below, because a lot of times vocalizing and sharing where we're at can be really helpful. So share below. Love reading all of your comments, and I'll see you guys all next time. Bye.